chance today to talk to you all, okay? So my name is Calvin Lagman. I'm a doctor of physical therapy for 20 years, serving the Brazos Valley for, I would say, 12 years or so. The last 8 years I've been working in Los Angeles, Arkansas, North Carolina. But when we went to College Station, my wife and we just fell in love with the place and we decided to stay here. So I've been practicing here ever since. So thank you for allowing us to talk to you today. And again, we are a group called Fyzical Therapy and Balance Center, okay? So what we are is an outpatient physical therapy clinic, okay, who has specialty with regards to vestibular and balance, okay? I know some of you all here have heard a lot of other outpatient physical therapy clinics right now, right? And some of you may even ask, so what's the difference if you're just another outpatient physical therapy clinic? Well, I'm kind of proud to tell you, not because I work there, but this is the truth, okay? So one thing that makes us different from other outpatient physical therapy clinic is that right now, as we speak, in Brazos Valley, okay, we are the only outpatient physical therapy clinic who has a proven paradigm to treat balance and vestibular disorder. So somebody asked me, so Calvin, are you trying to tell me, because when we were trying to, Mr. Philly here, our beloved franchise owner, okay, so when we were going over to every doctor's clinic, one of the doctor asked me this question. So if you are the only one who has a proven paradigm for balance and vestibular therapy that works, okay, because it's evidence-based, okay, so are you trying to tell me that if I go to other physical therapy clinics and I have a balance problem, my problem would not be resolved? Definitely, I would say that's not what we're saying, okay? All that we're saying is that Fyzical Therapy and Balance Center right now as we speak is the only outpatient clinic that has a proprietary paradigm specifically aimed for treating vestibular imbalance. So what does that mean, okay? So when you come to our physical therapy clinic, and let's say, for example, Dr. Imperial, our beloved doctor here, have diagnosed you to have some Meniere's disease, tinnitus. Those are inner ear problems, right? And those can sometimes make you fall, especially with our beloved elderly, right? Or let's say, for example, Dr. Imperial, you being a patient of Dr. Imperial or other doctor, as we speak, they look at your chart and they say, my dear, this has been the 11th, 12th time that you have fallen this year. I mean, would you consider 11, 12 times falling normal in a year? No. I bet you would say no, right? Because the answer is really, that's not normal, okay? So, if that happens often, then maybe, just maybe, there's really a problem there, why you've been falling lately, right? And the good thing about the paradigm that we have for physical therapy and balance is that it all starts with the evaluation, okay? With the evaluation. During the evaluation, okay, there is what we call as clinical test for sensory integration on balance, or what we call as CTSIB. Now, I'm going to make it very simple for our beloved audience for tonight. So what is clinical test for sensory integration on balance, okay? The hypothesis was formulated way back for our beloved astronauts back in the day, when we started first bringing man to the moon. And they have noticed that every time those astronauts go back, Dr. Imperial, the main problem with them is balance, okay? They may be in their 30s, but when they go back here on Earth, there's a balance problem, right? Simply because of the effect of no gravity in the moon. Am I right, man? And so because of that, okay, certain treatment and protocols have been formulated during that time, okay? And part of those protocol and treatment way back time has been evolving as time goes by. Because you know very well, even medicine evolved, right? What was used to be a treatment for this is not being used for this treatment right now because everything evolves, right? So our proprietary management for vestibular goes over with that kind of paradigm, okay? So basically when we see you and when you're referred by your doctor because you're a frequent faller, it all starts with an evaluation. During the evaluation, you will be categorized into 6 clinical conditions. 6 clinical conditions. Calvin, why 6? Because that is the paradigm itself, okay? In every clinical condition, okay, it depends on how you perform during the evaluation. Let's say, for example, patient A comes to me, she's a frequent faller. Okay, ma'am, let's do the assessment, a proprietary management treatment for physical balance and therapy. I'm gonna have to assess you first, okay? During the assessment, okay, we will be able to figure out, based on your performance, okay, what category do you fall into? Like I said, it's 6 conditions, right, ladies and gentlemen? So depending on where you fall at that 6 clinical condition, there is a specific treatment for that clinical condition, okay? Do you follow? And I did use the word specific. We're not talking about generalized therapy here, okay? So let's say, for example, you're the kind of patient who fell to clinical condition 1, wherein the problem with you is your eyes and your inner ear, okay? Fyzical is able to come up with specific protocol for those kind of condition. So having said that, clinical condition 1 to 6, depending on where you fall, if there's a specific treatment for that, what happens to the patient? The therapist is able to get to the root of your problem, right? Why you have been falling all this time, right? Oh yeah, that's why I've been falling, because based on this evaluation, I have a clinical condition 6, which means that my inner ear, my eyes, even the sole of my foot is the problem. You know what I mean? So you get to the root of the problem. And when you get to the root of the problem and you apply specific therapy to that problem, what happens to the patient, man? Do they get better? Of course they do, right? So that's what differs us from other therapy places. Because in other therapy places, if you have therapy imbalance, of course I would say, go ahead. There are my colleagues too, okay? Go ahead, you can be treated there, balanced, vestibular. But the problem is, the problem will be dealt with in general terms. Generally speaking, general treatment, right? Who would want to be seen by a specific clinician with specific protocol? We don't want that, right? It's not just, you come to a clinician's office and they do, okay, you go see me after 3 days and you'll be fine. But well, wait a minute, what's the protocol? What are you going to do with me? How am I going to get better, okay? So that's what makes us different from other outpatient physical therapy clinic out there. But I would like also to give an emphasis that not because our specialty is balance and vestibular disorder, it doesn't mean we only cater for those kind of patient. No. Because humbly, in front of you right now is a therapist with 20 years experience, okay? Humbly in front of you. So we do treat any conditions that requires physical therapy, whether it's fracture, whether it's a stroke, whether it's neurological disorder, you name it, and we will take care of you at Fyzical. Currently, I'm still affiliated with St. Joseph right now as a PRN therapist, so I am one of you here, okay? I just happened to venture my full-time role in joining Mr. Philly here because I believe in the advocacy of the treatment regimen. In my 20 years as a physical therapist, we were taught in medical school how to treat balance and vestibular disorder in a general way. There were no specific treatment that was presented to us back in those days. So as medicine evolved, treatment protocols also evolved. Do you agree? Right? And so with those evolution, with the involvement of medicine, comes specific protocol for specific problem. So that's what we offer for you right now. And we would like to speak to our elderly population, not because the younger populations are not that important. They are. But if you allow me to present you this simple presentation, you would realize why we would like to talk to our elder people first before we started discussing about the younger population, okay? Because it is the truth that between a younger population and an older population, who falls the most? The elder, right? Mm-hmm. Because unfortunately, we're all byproducts of aging. Whether we like it or not, we will get to that stage, okay? And they found out in studies that as we age, the reason why you're falling, man, it's not because you're just weak or you just did not eat breakfast or maybe lunch that time, okay? They found out that when you fall, there is what we call a sensory mismatch. Sensory mismatch. What do you mean, Calvin? What is a sensory mismatch, okay? When I'm standing in front of you like this, am I stable, sir? I'm not falling, so I'm stable, right? Because right now, all my sensory are at a match. What does that mean? My inner ear is working, okay? It can detect my position in relation to the space, right? my vision is working, I can see where I'm at, and that way I'm not like, okay? The sensory on the sole of my foot, what we call, if we get too deep, we call it proprioception. It's working better because I don't have any stroke, I don't have any Parkinson's. All of them are working together to keep me upright, right? However, as we age, those sensory parts of our body, one becomes weak, the other one takes over. What does that mean? For patient who falls, they found out that it's either you have vestibular hypofunction, meaning your inner ear is not that well, okay? In that way, when you're walking, you cannot really detect whether you're walking in a straight path or in a linear path, okay? Because there's problem with your inner ear. Who are this kind of patients? Let me give you an example. Patient who uses hearing aids, okay? Patients who had a stroke that affected the temporal part of their brain. Because the temporal part of the brain is the one that manages your hearing, okay? Who else? Patients who had stroke, patients who had Parkinson's, okay? These are the kind of patients who may suffer from vestibular hypofunction. So what happens then? If your vestibular is weak, but the vision is strong, sensory, proprioception is strong, what happens? Is there a balance, ma'am, or not? No. Thank you so much, ma'am, right? Why there is an imbalance? Because the proprioception is strong, the vision is strong, but the inner ear is weak. Am I right, sir? So that is what you call a sensory mismatch. Do you follow? So all three must act together in order for you to have a balanced position. Okay? However, if one is weak, the other one overcompensates. Right? Do you understand? So what does that mean? Let me give you an example. Being a physical therapist for 20 years, I've seen this a lot, okay? If you had a stroke and you were able to regain your movement, let's say you're a left hemiplegic stroke. You see them, they walk like this, right? Okay? Why are they prone to falling? Because the left side is weak. What happens to the right side, which is the strong side, it overcompensates. It tries its best not to make you fall, right? However, unfortunately, in doing so, it's not able to calculate the kind of help that the left side needed, right? So there is a mismatch. And stroke patients fall frequently. Parkinson's, they fall frequently too, right? Because there is a sensory mismatch. Do you understand the concept there, right? So, going back to physical, what we offer is this, okay? Once you are evaluated, based on the CTSIB, or the Clinical Test for Sensory Integration on Balance. Sensory on your balance, right? We will be able to determine what clinical condition you fall under. Clinical condition 1 to 6. I can tell you all the 6 conditions, but it would just make the presentation vague because there's a lot of medical terms to it, okay? So for the purpose of understanding tonight, we just wanted to let you know that each individual who has a history of fall could fall under those 6 clinical conditions. And what we're trying to tell you is that based on that clinical conditions that is presented, there is a specific protocol of treatment. You don't go to a clinic and they say, oh, I've been falling frequently. Oh, okay, let's bring you to the balance beam. Okay, try to balance yourself now. Okay, I'll see you in 3 weeks. They do get better, however, right? But after a month, what happens again? They fall again. And why, sir? Why, ma'am? Because they were treated, but they were not treated on the root of their problem. Do you follow, ma'am? Let me give you another vivid example. Sir, when you have a problem in your house, and plumbing is a problem, would you call a man who repairs the roof to repair your plumbing? You don't do that, right? You call the specific person for the specific problem. And that's what we're trying to offer you here, folks, okay? And again, I'm not saying the other clinics are not good. I'm not saying that because believe me, they are my colleagues too. I love all of them to death. What I'm just trying to say is that what we can offer differently at Fyzical, okay? And with that being said, allow me to present to you a very short information about falls and mobility. Is there any question before I continue? Okay, I see nothing but smiles. I'm starting to love you all, okay? This is a good group, Dr. Priel. This is a good group, okay? Okay, believe me, it's not easy talking to a lot of people, but it gives me pride in what I'm talking about because you would know if the person knows what he's talking about, right? You feel the pride in that person, right? And so I'd like to present to you this very simple presentation for falls and mobility, okay? So let's start. In a recent study, they found out that 25% of elderly population fall each year. Is 25% a big number, sir? It is. It is. Yes, sir. It is a big number, okay? However, this is the problem. In those 25% of elderly population, only half of them tells it to their doctor, like Dr. Imperial. Some of them never really tell the doctor that, hey, you know what? I had fallen last week before I saw you today. They fail to tell. Either they're afraid or they just forget to tell so, okay? However, 1 in 5 falls, of those falls, may cause serious injury. Have you heard of a patient who fell, open skull, fell, broken shoulder, fell, broken hip? Because it could really predispose you to serious injury, okay? Among those serious injury risks, hip fracture. Yeah, hey, we have a lot of that condition here. Believe me when I tell you, okay? As a physical therapist, Dr. Imperial, I usually see this. I see that patient for rehab month of February. Left hip fracture. And they started doing the rehab. And because they did well, they started to do wiggle and jiggle again, right? So they're doing well, right? And that is so good, right? However, this is the sad part. That is March or February, right? Here comes May or June. The same patient comes back. Patient A, what happened to you? We just saw each other 3 months ago. Oh, Dr. Calvin, this time it's the right hip. And when you ask the same reason, why did you fall? Well, what caused it? I fell again. Do you follow, man? Again, the culprit is falling. And sometimes as a clinician, you ask, this patient did rehab, why did he fall again? Oh, maybe because there is something that is not being dealt with. And that is what, sir? The root of the problem, right? To continue, hip fracture, 25%, 1-year mortality. Yes, unfortunately, there are elders who die after having hip fracture due to a lot of complication. And one of them, I believe, is sepsis, okay? So another one is subdural hematoma. We just talked about it. Patients fell, cracked their skull, or if the skull didn't crack, okay, but there's like bleeding from the brain, right? So what happens is that greater mortality to 50% mortality, right? So either way, fall is indeed a big problem, right? And this is a good slide that I would like to present to you. However, this slide is a sad slide. You know why, ma'am? Because it shows in this slide that as we age, between men and women, as we age, everybody is at risk of falling. Men and women. Okay? Do you follow that? Unfortunately, as we age, it does happen. Okay? So the blue is represented by overall population. It even shows the same, that as you age, unfortunately, we are at risk for falling. Okay? How I wish it was falling in love, right, ma'am? But it's the other way around, right? Alright. Next, okay? Because of that, when you fall, the primary that's affected is what? Your mobility. Because when you fell, you can no longer walk, or you can no longer do the things that you love. Am I right, ma'am? So they found out in recent studies too that 1/3 of older adults have mobility limitation. It is also the major determinant of well-being, and for most of us, it's more important to patients than falling. When you ask patient, okay, which is more important? Well, I'd rather be able to move around than falling. Which is true, right, ma'am? Would you consider falling or mobility? Mobility. Very good, ma'am. Who likes falling, right, ma'am? No one, right? Very good. Okay. So the big question is, we at Fyzical, we ask this question all the time. How do you prevent falling, and how do you improve mobility? Okay? How do you do that? You said you wanted mobility over falling, right, ma'am? But how do you improve your mobility, and how do you prevent yourself from falling? The biggest question is, what is the intervention that has the largest impact? I heard somebody says physical paradigm. Okay. No, what we're just trying to tell you is that at the end of the day, we need to get to the root of the problem. Okay? Because if you are treated and you are treated in a general way, the chances are you will get better, but you will still fall. Maybe in a month or two. Okay? So what is the intervention that has the largest impact? Okay? In a recent study, these are some of the things that would really help an elderly. Okay? First, think about that it's a matter of balance, okay? So an elderly should be engaging in 8-session workshop to reduce the fear of falling and increase activity among other adults, okay? However, they also found out that 97% of the participants feel more comfortable talking about their fear of falling. And I agree with this. When I see elderly patient, in fact, I've just seen a patient, evaluated a patient yesterday. When I evaluated her, Dr. Imperial, patient was strong. Muscle grade 5/5, upwards and lower. And I was asking that patient, man, what brings you here? Because for me, I don't think you should be here. Although Mr. Philly might not be happy to hear that, right? I'm just kidding, Mr. Philly, okay? But the thing is, when I saw her, she was strong and everything like that. And then she started telling me, you know what, Dr. Calvin, the thing is why I'm seeing you is because I may be able to walk right now, but every time I go to the second floor of my house, I don't feel good anymore. I always feel that I'm gonna fall. There is this fear of falling, right? So that is the point there. That's why I agree with this one, okay? That is really true among elderly patients. 99% of participants, they plan to continue exercising, especially if they see the benefit, okay? Okay, so we're not going to talk about this. These are other things, but Otado exercise program, another thing that can help elderly stepping on. Tai Chi is also good. You've heard about Tai Chi, right? So a matter of balance. This is where we fall under. Okay, physical. Okay? Because with our company, with our outpatient clinic, balance really matters. Okay? If you don't have balance, ma'am, sir, the tendency of you falling is highly likely. So at physical, this is what we're really focusing on, okay? Aside from other most important things, okay? But also they found out in the study that aside from any other things, one of the most important is exercise. Do you agree? Because when you are active, okay, the less likely for you to fall. Why is that? Because you are able to maintain the integrity of your muscles and the joints, your major joints, shoulder, elbow, hip, knee, and ankle, okay? They are the cornerstone for any conditions like arthritic, patients with strength problem, balance problem, neurological, patient with bone density problem, and cardiopulmonary disease, to name a few, okay? However, exercise in itself is insufficient. It's not enough, okay? So, what keeps you mobile then, okay? If it's not insufficient, okay? So, we always tell the patient, and this is the cornerstone of our treatment, okay? We will look into your entire neurologic system. We look into your proprioception, okay, your central nervous system, vestibular system, as we talked about it a while ago. Okay, we also do check your vision, muscles, bones, cardiovascular, anything at all, because all of these are contributory factor to your care, okay? Especially with patients who are frequent fallers, okay?
Calvin?
Yes, ma'am.
Can you back that up?
Yes, ma'am.
I don't know the difference between an afferent nerve and an efferent nerve.
That is a very good question that deserves a very good answer, okay?
Okay, I'm waiting.
So, afferent nerve, okay? When you talk about afferent nerve, think of the word A. A is away, okay? These are the nerves that send signal away from your major organs.
Okay.
Those are just example, okay? Afferent is also can be sensory, all right, Dr. Priel, right? And your efferent, okay, is mostly your motor, okay? Part of why you can work those muscles, okay? But they're all part of your CNS system or your central nervous system, okay? The slide is just saying that this is what keeps us mobile, okay? Because think of it, ma'am. If I don't feel the floor, will I be able to walk on it? That's your sensory, right? If I don't have muscle strength, will I be able to walk? Right? Not. That's why they're part of what keeps you mobile.
Would neuropathy fall under there too?
Yes, ma'am. In fact, I've been seeing a lot of elderly patients who have neuropathy who had a hard time keeping themselves stable when they walk. Okay, it's the aberration in the sensory system of some sort, but it's another topic which I would like to discuss should I be given a chance, with you guys, but it's part of it. Yes, ma'am. You're right about that. Did I answer your question, ma'am?
Yeah, you did good.
Thank you, ma'am. Thank you so much. Let's continue. Aside from that, if you have an overactive bladder, which a lot of you, I've heard of that you have this, okay? If you're not eating well, okay? And also another non-medical issues like cluttered floors, okay? Like scalper rags, okay? Or, If you have like a nephew or a niece at home whose toys are just on the floor, you step on it, you're done, right?
Grandchild.
Or grandchild, rather. Thank you, ma'am. So you can fall for that, right? So, also medications, right? I've seen a lot of patients who are taking blood pressure medication has the tendency to fall. That's why before I see my patient, I ask them, what medications have you taken before you came to my clinic, okay? Oh, I've just taken my metoprolol. I'm just taking my atorvastatin. Those play a part too, because it can make them dizzy, okay? Next. We're almost done here, okay? Because we're elders, okay? There's this thing they call as geriatric syndrome, okay? It is common in the elderly and results from additive small deficits from multiple system. What are those additives from multiple system? Okay, problems like tremor. Okay, who experienced tremor here? Who experienced restless leg syndrome? Right? Who experienced for no reason at all? This, everything is hurting, right? All of them are part of that. Unfortunately, we're all byproducts of aging, okay? So we at Fyzical, I'm almost done with my slides. The most important we say is detection. We start with detection, right? How do we detect why you're falling, ma'am? We do the assessment, right? And there are proper assessments for balance and vestibular disorder, okay? Because why do we need the proper assessment? Because how can I help you? How can I get to the root of your problem and make you really better if I'm just looking at you in a general point? Oh no, ma'am, you just fell because you were weak. Okay, let's put some 5-pound dumbbells on your ankle weights and let's do 15, okay? Okay, you're strong now? Oh, you won't fall anymore. That's not how it goes, okay? The assessment should be specific, okay? So, these are just suggestions on how they do it in some other places. So, there's a screening that should be done yearly, and that is so true. In fact, I believe most of our doctors today, they ask you this question. How many times have you fallen this year? And what were the incident that contributed to that falling? Things like that, okay? So detection, okay? Once you are able to detect that, okay, you are able to prevent future risk by recommending effective prevention strategies, okay? Things like educating patient on fall prevention, right? Things like vitamin D intake, referring them to community exercise for fall prevention program. By the way, we do that too, okay? And we will be proud to discuss it with you in the future, how we do that, okay? Perhaps we can have you attend that too, okay? Or there can be a reassessment of yearly or anytime patient presents with an acute fall. So my thing is, every time a patient comes to my clinic and they say they have a history of fall, I immediately look into that, okay? Because the thing is, it can happen again. And what's the problem with elderly when you fall? Fracture is very common, right? It is very common, right? And you don't want that to happen, right? Because fracture is not an easy thing, okay? So these are the things that we do to screen you, okay? And we do this at Fyzical, okay? We do your time up and go, 30-second chair stand, 4-stage balance test. These are all part of your balance assessment, okay? When we do the assessment at Fyzical. And that way we're able to determine where the problem might be coming from. Things like measuring blood pressure, your visual acuity using the Snellen eye, you know that. Assessing your footwear, whether you're taking vitamin D, or other comorbidities. Are you depressed? Are you taking antidepressant medication? Because those can contribute to your condition, okay? And lastly, other things to look at is your neuro exam if often appropriate, okay? Are you having sensory deficit, coordination problems, Parkinsonism, okay? And this is what I would like to share with you. Look for nystagmus or oscillation of the eyeball if possible. With Fyzical, we use this special goggles, Dr. Imperial, when I assess a patient. If a patient is suffering from nystagmus, we use a special goggle, okay, wherein I can look during the test or assessment if the problem, while I'm assessing for your inner ear, we can assess during the assessment while we're assessing the inner ear if there's an associated oscillation of the eyeball. Because recent studies show that when you do the assessment for the inner ear, if the patient is positive for oscillation or nystagmus, then really, Houston, we have a problem, okay? And we can deal with that. So that's the good thing about our place as well. We have that special goggles that is proprietary to Fyzical alone, wherein we can look at those nystagmus should you have one, okay? So lastly, with your indulgence, ladies and gentlemen, I have a form here which I would like to give to you, which, you know, with your indulgence, I would like to, Dr. Imperial, I would just like to collect. This is a full risk factor, okay? So what I want you to do is, if you can just put your name here, okay? This is just for us to see, okay? And there are several questions here. Perhaps you can answer it, okay? And based on how you answer the question, we could do a free screening where we can invite you to come to our place. We'll do the screening. Is that right, Mr. Philly? We'll do the screening so that we will be able to assess, ma'am, if you're one of those patients who can benefit from a balanced or vestibular paradigm treatment, okay? So I want to give this to you, ma'am. I want to give this to you. Okay. Yes, ma'am. Sir. All right. Let me come here. Thank you. Yeah. Thank you, sir. Thank you, sir Bob. Okay. Thank you, sir. Okay. And with your indulgence, there are a few questions there that you just have to check whether yes or no, okay? If no, just check no, and then we'll collect those papers and we can help you. And like I said, we can do screenings in our clinic, Dr. Imperial, to see, of course, with your indulgence too, okay, of your beloved patients. And we can do screening for them should anybody benefit for any balance screening or vestibular screening, okay? Okay. And as you answer that, I would like to ask everybody, first of all, I want to thank you for listening, okay? And maybe I would like to call the franchise owner, Mr. Philly, to give us a few words. Sir?
You said play.
Go ahead, sir.
Just a little bit about me. I went to Texas A&M, and my family, lived here all our life. And one of the reasons I started this business is I've always wanted to help our community. And my parents ran an Indian restaurant, and I loved interacting with Aggies. And both my brother and I, we went to A&M. He's a physician. He's in Pennsylvania with his wife, and I'm here. And my wife is a nurse. She's a rehab nurse, and you know, we really saw a lot of patients with falls, and we saw how what a negative impact it can have on their lives. And she genuinely loved working with our elderly patients, and so as an Aggie who's never left and who's always been here, you know, I just thought it was a natural business to get into, and you'll see me there almost every day. I still work with CHI. I worked all my career with St. Joseph, and I love what I do as a laboratorian. But you know, just being in front of the microscope is fun. Looking at slides is great, but I love the interaction with our community, the ability to talk to you guys. So you'll see me up front almost every day. Great, thank you.
Thank you so much.
Thank you.
Oh, and last thing that I would like to add, for those of you who are asking how did Fyzical started, it started in Florida, Dr. Imperial, year 2012, okay? It was started by a group of physical therapists and doctors. And right now, from 2012 to now 2023, we have about 500 branches across all over United States, okay? So you pretty much will see Fyzical in other states as well, okay?
I do have a question.
Yes, ma'am. Thank you, ma'am. Thank you for the
It was
question.
maybe a little more specific.
Yes, ma'am.
When you said you evaluate footwear,
Yes, ma'am.
what do you look for in footwear?
Okay, that's a very good question. One thing I look for as a physical therapist is you look where the wear is usually, okay? Whether it's in the medial or the lateral. That's
Okay.
one thing I look for too, okay? And when you remove the shoe, you usually see the insole of the shoe, right? When you remove your shoe, there's a depression there, right? I look for that as well. Whether the depression is so much on the toes or on the heel, okay? Because each of that, ma'am, will tell you what the patient is all about. Those are the things that I see. Where is the wear and tear from the outside of the heel, and where's the depression at the inner sole of the footwear of that patient, okay? Because that tells you a lot.
Okay.
Especially for our Parkinson's patients who are advanced stage but can still walk, they have a fascinating gait, right? When you open their shoe, ma'am, and you look at there, you will notice that the heel part of the insole is intact, but the forefoot is already so depressed. So that tells you that when they walk, the heel is always up And of course, you have a tendency to fall for that. Yes, ma'am. Did I answer your question?
Yes, yes, thank you.
Thank you, ma'am. Thank you.
When you have, go ahead.
Yes, sir.
I like heel toe.
Mhm.
That.
Yes, sir.
What's it, right?
Yes, sir. Yeah. Well, it really just depends on the condition because I have stroke patients that I see that are more like lateral walkers, you know.
Right, but are you asking what is the normal way?
Yeah.
Oh, the normal one, sir. I didn't hear you that
Yeah.
much. Okay. The normal is you should always start with heel strike.
Mm-hmm.
Okay, and then foot flat. Okay, and then heel off, and then toe off. That's the normal pattern. Heel strike, foot flat, heel off. Okay, and then toe off. Okay, so that is the normal pattern. Okay, so unfortunately, when patients have neurological conditions, those are diminished, and that's also predisposed them to have a fall. Okay. But that's also, sir, a part of the sensory mismatch, okay? We're talking about proprioception there. So when you get evaluated at physical, we will find out that too, sir. Yes, thank you for the question, sir. All right.
I had total hip replacement on this side,
How many years ago, ma'am, if I may ask?
5,
5 years ago.
yeah. And I'm 1 inch shorter on this side.
You were shorter on that side, yes, ma'am.
Is that normal?
Yes, ma'am. In fact, if you Google it, 62% of those patients who had recent hip replacement have shorter limb.
Yeah.
Yes, ma'am. It just really happens, unfortunately. So, but this is the tip. I want to give you a good tip, ma'am. When the therapist sees you, you come to our clinic. When we do evaluate you, if we have gait aberration, right, because of the leg length discrepancy, as we call it, if it's just a less than 1 inch, it can be resolved by wearing a shoe insole, like Dr. Schultz, okay? All right, although they're not cheap, right? But if it's beyond 1 inch, unfortunately, that's where you're going to spend money because you're going to have a shoe modification, which usually runs around $400 to $500. A shoe just for you. Because the thing about leg discrepancy, if it's not addressed properly, ma'am, it will also do a wear and tear on the other joint. Because remember what I just talked about, right? The other compensates when the other is lacking. Did that answer your question, ma'am?
Yep.
Okay.
Thank you.
So I'm all excited to see, not to say that, you know, but in my heart, I believe that we can do something for our beloved elderly population. So if you feel that you need, you know, improvement in your balance, some of you may be suffering from a long-term vestibular problem, consider us. That's all I'm asking. That's all we're asking. Consider us. And you will see how we treat our patients, you know. In our clinic, Mr. Philly and I in our clinic, we believe that, you know, at the end of the day, it's all about love, okay? More than the business, it's all about love.
So if I come, I'll find love?
Yes, ma'am. And you know what love means. Given by Calvin and Mr. Philly, okay, ma'am? You'll see that, ma'am. L-O-V-E. Yes, ma'am. Nothing but love, okay?
So, Calvin,
Yes, sir.
I assume
Mr. David, nice to meet you, sir.
assume you don't take Medicare?
Mr. Philly?
No, we take Medicare.
You do?
We
Oh, okay.
We do. We take both.
So if a doctor assigned you for balance treatment, then you would accept the Medicare assignment?
Yes, sir, we would. We would.
Yes, sir.
Yeah.
That's a good question, sir. All right. Yes, sir. Mr. Bob, nice to meet you, sir.
Thank you.
Yes, sir.
What if you have what you think is pretty good balance, but you got this little dog running around at your feet?
Well, during the interview, I'll find that out. Calvin, I fell because my dog pulled me, so. But we'll still do the evaluation anyway, sir.
My mother tripped over a dog.
Yes,
and
sir.
broke her hip.
Yes.
I had a friend less than 2 months ago
Mm-hmm.
visiting some people, tripped over the dog and fell on the floor.
I'm sorry to hear that, sir.
Yeah.
Yes, sir. But like I said, sir, things like that do happen. But when they come into our clinic, we still evaluate them anyway, okay? Because I think Dr. Imperial will also agree that the most important part of patient interaction is the interview. Because from the interview, you will already know what's really happening, you know. The test that we do as clinician only confirms what, you know, we feel is happening, you know. Because without those tests, you know, a clinician's word is just a clinician's word. There should be a test, okay? Okay? Like when your beloved doctor tells you, oh, you have high cholesterol. What is the test? Oh, I just look at you. I think you have high cholesterol. There should be a blood test, right? So that's what I'm just trying to tell you guys. So at the end of the day, guys should be tested. Another fact is that a lot of patients come to me, oh Calvin, I have this and I have that, and unfortunately, Dr. Imperial, when you read the chart, there is nothing there. Did the doctor miss it? No. It's just that in our population right now, there's a lot of hearsay. Maybe she had talking to her another friend. Oh, you know what? My elbow's always hurting. Oh, you have arthritis. Oh yeah, I have arthritis. And they started going to the clinician or whoever. Oh, you know what? I have arthritis. Was that a proper diagnosis? No, it's not. My friend told me. So it has to be a proper diagnosis. Okay? Oh, my balance is poor. Let's check you. Okay, let's evaluate you at physical. We'll find out, right? And perhaps we can help you. All right? And at the end of the day, we're here to tell you what we do and what we're here for all of you. Okay? Any questions more?
But you don't do anything at home like after surgery or something?
Well, that would be a home health therapy, ma'am.
Okay.
Ours is
that's
an
not
outpatient.
your-
Yes,
okay.
ma'am. Yes, ma'am.
Okay.
Uh-huh. Usually the route right now is that after you go to a surgery, they send you to an inpatient rehab. And after inpatient rehab, they send you to us, the outpatient. And then once you have gotten better, they send you for a home health. And after home health, voila, you're done. Free from those clinicians, right? Yes. And I would just like to reiterate how thankful we are, Dr. Imperial, and this goes by the heart, okay? We'd like to thank you and your beloved staff and your wife for allowing us to be here and be able to share what Fyzical is all about. Because at the end of the day, every chance you get from your beloved doctors is really worthwhile. So we are thankful.
Well,
We are
thank you
so thankful,
guys. Yeah,
Doctor.
we appreciate you coming over and
Thank you.
And in
we're-
any case that we could be of service, just let us know, okay? We're just across the street.
yeah.
I can be an Uber for you too. All right, love, right? At the end of the day, love, right? Yes. Any more questions?
Business cards?
Yes, we have a business card.
Yeah, I